Good evening. It's 8 o'clock. The top headlines tonight. The Omicron variant of COVID is now in India with 2 cases being reported in Bengaluru. One, a 66-year-old foreigner, the other, a 46-year-old Indian doctor. The Indian doctor had no foreign travel or contacts. Patient number 1 was 66 years old. He came in from South Africa via Dubai, but he recovered fully and left India last week. So the big question, how did the 46-year-old Bengaluru doctor get the Omicron variant? 5 contacts with the doctor have tested positive, not clear if they've got Omicron yet. The good news is both cases were fully vaccinated and had mild or no symptoms. The health minister of Karnataka says the takeaway is that Omicron seems milder than the Delta variant. Well, with the Omicron fear, vaccinations shoot up in Mumbai and India has now crossed 125 crore doses. Meanwhile, Maharashtra changes its flying guidelines. Now, vaccinated domestic flyers don't need RT-PCR tests, but there will be institutional quarantine for 3 high-risk nations passengers from here. They are South Africa, Botswana and Zimbabwe. Maharashtra's guidelines different from the rest of India. The Supreme Court's 24-hour deadline to the centre and Delhi on air pollution as levels hit severe once again. Clean up industrial and vehicular pollution, says the Supreme Court to the centre and Delhi, or we'll set up a task force. The court asks, in the severe pollution, why are Delhi schools open? So schools which opened on Monday are now shutting again tomorrow on Friday within 4 days. NDTV exclusive, the government plans on the new crypto bill which will be tabled in Parliament this session. The name has been changed from cryptocurrency to the crypto asset bill. All crypto will be regulated, not banned, and they will be regulated by SEBI. A 45-year-old farmer in Telangana dies by suicide. He consumes pesticide. The Telangana farmer, amongst many others, was waiting in vain for paddy procurement by the government. Despite promises, the farmers have been waiting for days for paddy procurement. In many cases, the paddy just going waste with no buyers. Congress leadership is not a divine right. Mamata Banerjee's political strategist Prashant Kishore now takes on Rahul Gandhi directly. The election strategist tweets a day after Mamata Banerjee's attack on Rahul Gandhi. Yet, as people ask, the Prashant Kishore was wooing the Congress this year and now the Congress is his target. The Congress responds, we were never ally of the BJP like Mamata and we won't respond to consultants. Meanwhile, election battleground, it's Amit Shah and Priyanka Gandhi in West UP. Arvind Kejriwal's Tiranga Yatra in Punjab. Navjot Singh Sidhu hits out at him after Kejriwal had praised him. Players hesitant and uncertainty now over India's South Africa tour. Team selection announcement is delayed. The decision is likely by Sunday on whether the tour goes ahead. Well, our lead story tonight, India's first 2 cases of the Omicron variant of COVID has been detected in Karnataka and Bengaluru. One, a 66-year-old foreigner, the other, a 46-year-old Indian doctor. Both of them were infected in the last week of November is when the test came positive, but they had mild symptoms or were asymptomatic. The government said all contacts of these 2 have been traced and were tested. So far, at least 373 cases of Omicron have been detected across 32 countries, the US and now India as well. The government says, get vaccinated, don't panic. Now, let's just go into exclusive details that NDTV has got of both the patients. Now, patient number 1, a 66-year-old foreigner from South Africa. He's recovered and has actually left India. He came into India on the 20th of November. He tested negative in South Africa. He arrived in Bengaluru and then tested positive here. On 22nd November, his sample was sent for genome testing because of South Africa's, he came from there. And on the 23rd, that patient test was COVID negative. So on the 27th, he left India. He had 24 primary and 240 secondary contacts, all of whom were negative. But patient number 2 is the more interesting and perhaps worrying one because could it indicate local transmission? This is a 46-year-old doctor in a Bengaluru hospital. He's got no foreign travel history, no foreign contacts. Now, of his contacts, 5 people have been tested positive. He is positive on the 22nd of November with no travel history. He is discharged from hospital on the 27th of November and his symptoms are very mild. Now, of his 13 primary contacts, 3 tested positive. Of his secondary contacts, only 2 tested positive out of 205. And again, the symptoms were very mild, and of these 5, we don't know yet if they got Omicron or not, but their symptoms are also very mild. They're in isolation. Today, the government announcing this said, do not panic. The main thing is get fully vaccinated.
24 घंटे के अंदर हमारे देश में 2 ओमिक्रॉन वेरिएंट के केस हमारे इस नेटवर्क के द्वारा डिटेक्ट किए गए कर्नाटका में, जिसकी रिपोर्ट कल रात काफी लेट आई थी, जिसको हम आपके सामने रखना चाहेंगे.
India's first 2 cases of the Omicron variant of COVID. Both have recovered and one has even left India. One of them is a 66-year-old patient who came from South Africa. The other, a 46-year-old healthcare worker who has no travel history. One of the 2 patients is fully vaccinated.
Here is what we know about the 2 patients. Both have recovered, and the 66-year-old in the span of a week tested negative before his flight, then positive on arrival, and then 3 days later tests negative. This Omicron case was asymptomatic.
Between the 2 cases, almost 40 primary contacts and over 400 secondary contacts have been tested. And of the second patient, 3 primary and 2 secondary have tested positive for COVID and are in isolation.
We need not panic, but awareness is absolutely essential. And not going to and not organizing mass gatherings will help breaking the chain of transmission of Omicron.
The Delhi Chief Minister called for tighter restrictions while the Maharashtra government announced new rules, making institutional quarantine mandatory for passengers from 3 countries, South Africa, Botswana and Zimbabwe. At India's airports, passengers are understandably anxious and under all sorts of pressures.
I have my flight on December 10th, but had to book another one because of the new virus. I had to book it because I am scared that I would be stuck here, that I would lose my job.
Landed on the 29th of November, one day before the new restrictions were imposed. I realized that I was pretty much stuck between a rock and a hard place when I tried to book my ticket back to London in January, and I was shocked to learn that the price of a ticket was 3,70,000.
But of the almost 8,000 passengers who have come in from India's list of at-risk nations, only 10 or so have tested COVID positive so far. That's just 0.13%.
The entry of Omicron in India poses yet another challenge in the fight against COVID-19. And while the highly mutated variant of COVID-19 is causing a scare across the world, our best bet against COVID-19 still remains vaccination and COVID-appropriate behavior. With camera person Xavier Thomas and Nihal Kedwai in Bangalore, I'm Akshay Dongre for NDTV.
Well, let's go across to our special guests now tonight. I'm joined by Professor Shabir Ahmadi. He, of course, is one of South Africa's most prominent vaccinologists. Thank you for joining us from Johannesburg tonight. I'm also joined by Dr. Sudarshan Balal, of course, a well-known Karnataka medical experts, doctor and a member of the Karnataka COVID Task Force. Dr. Balal, I'll go across to you first because of the 2 cases being reported from Karnataka. One, of course, has already left Karnataka. Now, there's some good news coming out of this, that they were both fully vaccinated and the symptoms were extremely mild, or in one case, the South African national, there were virtually no symptoms. So, do you feel that Omicron is perhaps not as worrying as we once thought, or these are early days yet?
Good evening and thank you for having me here. As you rightly pointed out, I think it's a new variant, so we do not have enough information. From whatever we know, it is extremely infectious, far more infectious than the Delta variant. And so far what we have seen is it's an extremely mild disease. We have rarely seen any hospitalization, ICU requirement or mortality. So that is sort of the silver lining. The only variable that we are still not fully aware of is whether it escapes the immune phenomena of the current vaccinations. I'm not surprised it has come to India. I would be surprised if it hadn't come to India. We are a population of 1.3 billion and the world is now a small village. So if it spread to other countries, it was quite obvious that would come to us. However, what is important to realize is that the prevention of spread of COVID is the same, whatever be the variant.
Yes.
First is the public health measures, intense surveillance, including a genomic analysis of the samples that are needed, masking, social distancing, hand washing, and of course the important tool now we have is vaccination. So we should aggressively pursue vaccination in addition to implementing strict COVID-appropriate behavior.
Right.
That's the only way out. Certainly no panic.
Absolutely. And if I can bring in Professor Madhi here, because South Africa is really, I think, the cases and the rate of hospitalization is being watched by the world. But of course, we now know that the cases could have been first in the Netherlands. And interestingly, one of the cases here is a 46-year-old Indian doctor who hasn't even traveled abroad. So what are you seeing, doctor, as you're watching the Omicron being reported from across the world? Do you now feel that this is not something we need to observe as some kind of South African case study, but we need to be looking globally at all the data that's coming in? And what are you finding, since you, of course, you are the Director of Vaccine and Infection Diseases Analytics, what do you find as the key features now of this variant?
So thank you for having me. So I think you're completely correct. The variant most likely did originate in Southern Africa. And that's the reason why we're identifying so many cases currently in Southern Africa. And it's not 200 or 300 cases. We need to remember that even in a country such as India, as is the case for South Africa and globally, it's only a small percentage of people that are infected that even come forward to be diagnosed and to be investigated. In addition to which, of all of the people that are infected, we're only doing sequencing on a fraction of all of the positive cases. So right now in India, if you've already got 2 cases, including one doctor, as an example, has been infected without a travel history, you can be rest assured there's probably thousands of other cases in India as there is in South Africa. And that goes for any other country where the virus has already been identified, and particularly in an absence of individuals having a travel history to Southern Africa. So it's a completely futile exercise to lock your country to have a travel ban on a small group of countries, yet allow people from other countries to travel to your country who are still allowed to travel to South Africa. So it's just a matter of time before we see a further dispersion of this particular variant. When it comes to the severity of illness, the experience in South Africa is that most of the illness is mild. And I think similar to India, it's not only about vaccines. There's another dimension to this. And that is right now in South Africa with the Sero survey, looking at how much past infection has taken place. Close to 3/4 of the population have been infected during the course of the first 3 waves. And there's similar sort of data from India. And that past infection doesn't really protect too well against reinfection, but it protects quite well when it comes to preventing infection progressing to severe disease. So right now, this variant is evolving at a space of time in low and middle income countries where the substantial amount of immunity has been built up, at least against severe disease. So we will see large number of cases, including of reinfections taking place, including breakthrough infections because in people that are vaccinated, but not severe disease.
So that's an interesting question. Even in India, we saw, even though our vaccinations have crossed 49% today, I think South Africa is lower than that, of course. But the previous infection was a major issue in our second wave with the Delta variant. So that perhaps will give us protection. Let's see. But Professor Madhi, the point, we just took a graphic of how much South Africa cases are going up. So pointing perhaps to the transmissibility of the Omicron variant. But what is the impact on hospitalizations? Because that, of course, is the big worry for the globe around, that the infection may be one thing, the number of cases, but hospitalizations and deaths is really what we don't want to see, a repeat of the Delta variant.
Absolutely. And I think these sort of figures that you're just showing right now are somewhat depressing and can cause panic. And what you're saying is exactly true, that we're seeing a massive surge of cases, and especially in the one province where this particular outbreak initially started. But when looking at hospitalization in the same province, we're not seeing as rapid an increase in hospitalizations compared to what we have seen during the course of the first 3 waves. So the hospitalization rate is increasing and probably will lag behind by about 2 to 3 weeks compared to the cases that are occurring in the community. But the rate of increase in hospitalization is slower than the rate of increase in infections, which right now seems to be greater than what we experienced during the course of the first 3 waves. And it speaks to the issue of the unhinging of infections and hospitalization and death.
In fact, I'd like to bring in Dr. Bilal on that, because Dr. Bilal, India is, of course, in a good spot right now in the fact that our cases are now the lowest in the last 18 months. Our vaccinations, we've crossed 125 crores. We've crossed 49% fully vaccinated. But this worry that the doctor in Karnataka, a healthcare worker, had no travel history, no foreign contacts. Do you feel that we must now be looking at booster shots perhaps for healthcare workers, definitely frontline workers? And the second, that Omicron may well be in the local population now?
I think both the things that you mentioned are true. I do believe we cannot rule out a local infection. We still need to have more data. We've just seen this doctor with no travel history, no previous contact test positive. It will be interesting to see what is primary and secondary contacts who are positive, whether they also have the Omicron variety or something else. So I think we still need some data, and I'm sure the public health officials will give us more data on that. The question of a booster dose, I think vaccination is the key as of now, still to sort of prevent serious disease and mortality in all forms of COVID. Hence, I do believe that the first dose should be given to anyone who's not received it, second dose to the people who received the first dose, and certainly a third dose or a booster for the people at high risk. And India has demonstrated that we have done quite well. We have managed COVID reasonably well so far. And fortunately for us, there is enough vaccines available. We have great infrastructure. We have vaccinated up to 2.5 crore people in a single day. So I don't see any reason that all three of these can go parallelly, not at the cost of each other. I certainly feel the first and second dose should be priority, and the third dose to the high risk should be offered at the earliest.
Thank you so much, Professor Madhi and Dr. Balal. Thanks for joining me with your perspectives. And as Professor Madhi pointed, the unhinging or the unlinking, perhaps the delinking of the number of cases with hospitalization and deaths would be a welcome new turn perhaps in this virus. Thanks very much for that. And well, the good news is that vaccinations are going up, at least in Mumbai, after the Omicron fear. And we've crossed today a great milestone of 125 crore vaccine doses. 49% of India's total population is now fully vaccinated.
The Omicron variant of COVID can be thanked for this queue for vaccinations. Same place a fortnight earlier when private vaccination centers were completely empty.
वो टाइम नहीं था, ऑफिस था, एवरीथिंग मतलब शिफ्टिंग था, घर का शिफ्टिंग था. अभी क्या जरा टाइम मिल गया, सब कुछ काम हो गया है, तो वो हिसाब से ले रहे हैं.
मेरा शिफ्ट चालू था ऑफिस का 1 to 10:30 बीच में एकदम.
The average daily vaccinations over the last 3 days are well over 10 lakh doses, up from around 5 to 6 lakh doses in mid-November. Doctors see this as a silver lining of Omicron.
ओमिक्रॉन नाम का नया स्ट्रेन डिटेक्ट हुआ है कोविड-19 वायरस का, तो उसकी वजह से जो है लोगों के मन में डर जो पैदा हुआ है वो इसके लिए रिस्पॉन्सिबल दिख रहा है. और लास्ट 1 वीक में जो नंबर ऑफ पेशेंट्स या नंबर ऑफ बेनिफिशियरीज जो थे जो वैक्सीन के लिए आ रहे वो काफ़ी मात्रा में बढ़ गए हैं. जो वैक्सीनेशंस के लिए लिमिटेड नंबर्स हो रहे थे वो अभी ऑलमोस्ट 5 to 10 टाइम्स बढ़ गए हैं.
कई सारे लोग जिन्होंने की फर्स्ट डोज भी नहीं लिया था वो भी देखने को आ रहे हैं, और जिन्होंने सेकंड डोज अपना मिस किया था, जिनका सेकंड डोज ड्यू है, वो लोग भी आके वैक्सीन लेके जा रहे हैं.
In Mumbai, with Pooja Bhardwaj, Saurabh Gupta, NDTV.
Meanwhile, forget COVID. What about air pollution? The Supreme Court today came down very strongly on the centre and the Delhi government, saying first that within 24 hours, they want an answer on the industrial and vehicular pollution, which has led Delhi air to be so severe in its air quality again. They also said, why are schools open as air quality is so severe? So Delhi schools then shut again after reopening just this Monday. They've been shut from tomorrow after the Supreme Court wrap. A 24-hour deadline given by the Supreme Court. They will sit again tomorrow at 10 a.m. and they want answers from the centre and Delhi government, or the Supreme Court has said, we will set up a task force to address this issue of air pollution, as across the North India air quality levels are severe once again today. Well, other big headline tonight, an exclusive note on what the government plans are on the new crypto bill, which will be tabled in Parliament this session. Well, the big story is that there's no ban planned on cryptocurrency. In fact, it won't even be called cryptocurrency. It's going to be called the crypto asset bill. So a clear indication that the government is going to classify this as an asset. Also, it will not be recognized as legal tender or currency, as the finance minister said. The bill's name has been changed from cryptocurrency to crypto asset. The government is saying it will follow the middle path, as they don't want crypto to go into the dark net. This will be dealt with only by exchanges, which will be regulated by the Securities and Exchange Board of India. Well, moving now to one of our special reports, and this has become a huge political tussle between the TRS government in Telangana and the centre as well over paddy procurement. Tragically, today a 45-year-old farmer died by suicide in Telangana. He consumed pesticide as he was sitting with his unsold paddy crop.
45-year-old Betu Kumar drank weedicide and collapsed on the same mound of paddy that he had been safeguarding for 2 weeks now, hoping to sell at the paddy procurement center in Mulugu.
సంచులేం ఇవ్వలేదు సార్, వడ్ల రాసి మీదనే కూర్చొని తాగి వడ్ల రాసి మీదనే వడ్ల రాసి కానే ఉన్న తమ్ముడు ఇన్నే తాగిన, నేను గడ్డి మంది తాగిన, ఇక నేను బతకాను. ఈసారి కూడా ఎవరు కొట్టలేరు నీకు అప్పు కడతాను అందుకు కొట్టానని అన్నాడు. అవి సీడట్లు కూడా వ్యవసాయ కొనేటి ఎవరు కొట్టలేరు ఇంకా అన్నాడు.
కొంటలేరు 2 ఎకరాలు ఎట్లా పోయాలని అట్లనే ఉంటుంది. ఒక రైతుకు ఒక 2 ఎకరాల పొలాన్ని ఇచ్చి పెడితే ఎంత బాధ ఉంటుందో ఒకసారి ఆలోచించాలి. ఆ రకంగా మొత్తం అప్పులు ఎంతమంది చేసిన అప్పులు అన్ని మన ఆత్మహత్య కారణం.
In villages across Telangana, this is the situation. Farmers are bringing their paddy to the paddy procurement centers, but there are no buyers. Farmers say, in between the political battles of the center and the state, it is the farmers' lives that are being played with. The Telangana government has blamed the center and has demanded that, like in Punjab, the center should buy 90 lakh tons of kharif paddy instead of the 40 lakh tons they are procuring.
पूरा इसमें 3 महीने से काट के लाया मैडम, इधर रख दिया तो उसे बोल रहा था केंद्र वाला नहीं ले रहा, बोल रहा इधर राष्ट्र वाला नहीं बोल रहा. ये झगड़ा कर लिया तो आपको रैत वाला क्या करता है मैडम?
Political battles can be fought in parliament and outside it, but for the farmers, the distress is mounting and it could become a do or die battle for survival. Both the state government and the center need to treat this as an emergency. With camera person Nagraju, Uma Sudhir, NDTV.